Sanka, and it's an honor to be with you today to discuss a topic that is near and dear to my heart: elevating school nursing practice through targeted professional development. As school nurse leaders, we know that professional development isn't just about meeting licensure requirements. It's a way to elevate the quality of the care that we provide, support our own growth, and foster the well being of the students and the communities that we serve. Today, we will explore how to design learning opportunities tailored to school nursing with a focus on accreditation and impactful outcomes. To frame our session, I'd like to share these words from Nelson Mandela. Education is the most powerful weapon you can use to change the world for the better. This encapsulates the essence of what we're doing, using education to create real positive change in school health. As we all know, school nursing is unique in that it bridges healthcare and education. And unlike traditional healthcare environments, school nurses work within educational settings, managing both health, complex school dynamics, and student health. But because of that complex setting, there can be a scarcity of professional development opportunities that are tailored specifically for school nurses. The benefits of professional development are numerous, and here's just four of them. Professional development promotes confidence, skill enhancement, and professional satisfaction. It keeps us updated on the latest clinical practices and school health policies and legislative changes. Quality professional development can foster a stronger sense of leadership and professionalism in the school setting. And the benefits extend beyond the individual. For school districts, investment in professional development for school nurses leads to stronger student outcomes and improved efficiency. It increases staff and parent trust in school health services, and districts who invest in school nurse development show higher nurse retention rates, smoother succession planning, and improved recruitment. Let's start by talking about quality improvement and school nurse competency. There are 6 key domains of school nurse competency that every leader should consider when planning for professional development. They are patient-centered care, critical thinking, legal and ethical standards, communication and collaboration, school health services, and health education. Let's take a look at each of these a little closer. So I'm going to go through these domains and offer examples of professional development programs that you might develop to meet the needs of your district. Patient-centered care keeps the student at the core of our practice. So training in this area could include nursing assessments tailored to the school setting or emergency preparedness, where nurses might practice responses to scenarios like natural disasters or lockdowns. Programs like these help school nurses respond swiftly and effectively, ensuring student safety. And for critical thinking in school nursing, that's just essential. And while there's some overlap with the other domains, we can really see the importance of critical thinking for emergency situations, such as an anaphylactic reaction or school crises, like a high-risk mental health scenario. Drills and case studies guide nurses through real-time decision-making frameworks and evidence-based protocols. Similarly, critical thinking exercises can be applied to infectious disease management or to evaluate health service delivery to identify unmet student health needs. It's always important to emphasize evidence-based practice to equip your nurses with the skills to handle emergencies and make informed decisions. This is a big one. Navigating the legal and ethical landscape in school health can be challenging. Professional development on school health laws provides updates on local and federal regulations, while training in ethical decision-making uses case studies to prepare nurses for complex situations, like balancing student autonomy and parental rights. And communication skills are fundamental to school nursing. We all know that. So workshops on therapeutic communication can enhance trust building with students and parents. Training on interdisciplinary collaboration strengthens partnerships with teachers, counselors, administrators. Maybe your professional development program will cover the best practices for documentation or reporting, which are both critical for the continuity of care and legal compliance. With any school health service delivery, it's important to analyze its effectiveness. So you can't just ask your nurses to do this. They need training on how to analyze the services being provided and design and implement new services. So you might have training in that analysis, as well as data-driven strategies to ensure that those services align with the health needs of your school population. And health education. This is where we talk about educating our students. So this is our final domain. Maybe your nurses provide structured health education as part of the school curriculum, or maybe they just do just-in-time training as health education needs arise. So training in this area could include analyzing student health needs and designing interactive lessons like topics of nutrition or mental health. Evaluation methods help us refine these programs to make a measurable impact on student wellness. So, by focusing training on these 6 competency areas, we're ensuring that nurses not only meet standards, but can also drive quality improvement within their schools. Now let's talk about accreditation. Before we begin, it is essential to distinguish between professional development points and nursing continuing professional development. So one is PDPs and one is NCPD. PDPs apply to individuals who have teaching licenses in addition to their nursing license. So that includes some school nurses, and that often aligns with educational programming. In contrast, nursing continual professional development provides nursing contact hours that are specific to nurses for nursing license renewal. Knowing the difference is essential when developing content for a diverse audience that might include both nurses and educators. So there's a lot to accreditation, and we're going to start with the basics. So here's just a quick snapshot of what that looks like. You're going to want to meet the accreditation standards very closely, and that is crucial for getting the contact hours credited for your professional development program. So you'll start with a learning needs assessment. Then you're going to identify an accredited provider who will grant those contact hours. Then you'll develop a learning outcome or outcomes that are specific, measurable, and relevant to nursing practice. You'll ensure that the content aligns with evidence-based practice and that you have subject matter experts involved. You will evaluate the program both on its effectiveness and if the learning outcomes have been achieved by the participants. And finally, you'll submit the necessary documentation to that accrediting body to gain approval for your program. So let's look at this process a little more closely. A learning needs assessment pinpoints knowledge or skills gaps within your target audience. So methods like focus groups, surveys, and questionnaires can provide insights into the areas where school nurses feel they need more support. Additionally, a review of health and safety data in your district can help identify areas where school nurses might need more training, such as high rates of absenteeism due to illness or the number of health-related incidents at a school. You might also look at the literature or professional standards for any changes or trends. The assessment is used to identify a learning need described as a professional practice gap. It can be a knowledge gap, a skill gap, or a practice gap. The professional development program is then developed to close or narrow that gap. This process ensures that our programs are relevant and aligned to current challenges. If you're not an accredited provider, you can partner with one. Many state organizations, healthcare organizations, and higher ed institutions are accredited providers. Connecting with these organizations ensures that your program meets the standards for contact hours and supporting the licensure. The American Nurses Credentialing Center, or ANCC, is a national accreditor that provides contact hour accreditation through these organizations. You can find a list of accredited organizations through their website or by contacting them for more guidance. Clear learning outcomes are the key for accreditation. Learning outcomes are built out of that identified learning gap. The desired learning outcome is written as a statement and should reflect the way the program will close or narrow that gap. Now, if you're finding it hard to articulate an outcome that aligns with your learning gap, then Bloom's taxonomy is an excellent place to start. It is a tool for structuring outcomes at different cognitive levels, using verbs like describe, demonstrate, or analyze. The ANCC also provides specific guidelines to ensure outcomes are measurable and aligned with professional standards. Additionally, there are numerous online resources and workshops available to help you. When in doubt, keep it simple. For most programs, 1 to 2 outcomes is enough. So, to build a quality program, we rely on evidence-based practice and content matter experts. The primary nurse planner, in this case, you, and perhaps a planning committee shape the program, select the relevant topics and credible content. Content experts are chosen based on their qualifications, and they are asked to provide CVs that detail their expertise. Disclosure of relevant financial relationships is required to prevent bias. For example, a content expert who's delivering a program on ADHD treatments might also receive funding from a pharmaceutical company, and they would need to disclose this. The planner, the primary nurse planner, would then mitigate the risks of bias to ensure a balanced presentation. Sometimes that is done through content review, and sometimes it is done by adding alternative viewpoints to balance that potential bias. Program evaluation. Evaluating the program's impact is required for accreditation and quality improvement. Methods like pre- and post-test assess knowledge gains, while surveys provide participant insight on relevance and effectiveness of delivery. To evaluate skill acquisition, consider an evaluation method like return demonstrations or simulation. And to evaluate the impact in the long term, an analysis of district health data at set intervals can reveal how learning has been translated into practice improvements. So that's our overview of accreditation. Before we wrap up this micro-learning session, I would just like to briefly touch on a few additional considerations when planning your professional development program. You will want your program to be engaging and accessible. So consider using a mix of learning methods like workshops, simulations, escape rooms, and online modules to cater to diverse learning needs. All of your planning might be perfect, but not achieve your desired outcome if it's met by the resistant learner or administrative barriers. So you can create a supportive learning environment by offering flexible options like online courses to make participation easier for school nurses with busy schedules. Lastly, as you become professional development education experts, I ask you to consider who else has learning needs. Can you provide education for the teachers in your district? Or start a parent education program? Will you present about a new initiative to your administration or school board? The opportunities are endless. Thank you very much. To conclude, professional development is essential for advancing school nursing practice. Beyond meeting licensure requirements, it enhances the quality of care. It strengthens our role as leaders in school health. So thank you for your time. I look forward to seeing how each of you will use professional development to drive positive change in your school. And here are my references. Thank you so much.